Researchers have found different ways to treat COVID patients as we await a vaccine. Our senior Washington correspondent Blair Miller just looked at plasma donations. He found out why they're not all created equal.
Blood taken from the sickest COVID-19 patients may make for the most effective convalescent plasma therapy treatment. Researchers at Johns Hopkins University are studying how it works. Plasma from recovered patients contains antibodies and is used to treat new patients. In a new study, researchers tested the blood of 126 COVID-19 survivors and noticed three important factors. Scientists say they now know that the sicker a patient is with the virus, the stronger the antibody response seems to be. The study also shows that the age and gender of blood donors seems to make a difference as well. Researchers found that older men who were hospitalized with coronavirus were among the strongest candidates for plasma donation. That study is published in the Journal of Clinical Investigation. I'm Blair Miller.